Have you ever wondered what irritable bowel syndrome really is? Often abbreviated as IBS, it's a common disorder affecting the large intestine, causing symptoms like cramping, abdominal pain, bloating, gas, and diarrhea or constipation or both. According to the International Foundation for Gastrointestinal Disorders, up to 15% of the global population may be affected by IBS. Understanding this complex condition is crucial as it significantly impacts the quality of life of those affected. Now that we know what IBS is, let's delve into its symptoms. What are the telltale signs of IBS? How does one identify it? Well, let's delve into the 5 common symptoms of irritable bowel syndrome, or IBS, that might help you recognize this condition. First up, we have abdominal pain. This isn't your occasional stomachache. It's a chronic discomfort that often eases after a bowel movement. It's a pain that persists, and it's a clear sign something isn't quite right. Next, we encounter bloating, a feeling of fullness or swelling in your abdomen. It's an uncomfortable sensation that can last for hours or even the entire day, making your clothes feel tighter and your belly appear distended. The third symptom is constipation, characterized by infrequent bowel movements or difficulty passing stool. People with IBS often struggle with this, going several days without a bowel movement or finding it challenging to go. On the flip side of constipation, we have diarrhea, a symptom that sees individuals with IBS experiencing loose, watery stools more frequently than normal. It's often coupled with an urgent need to have a bowel movement, which can be particularly disruptive to daily life. Finally, we have changes in bowel movements. This means alternating between constipation and diarrhea, or noticing differences in the color, size, or shape of your stool. It's a symptom that keeps you guessing, and it's a key indicator of IBS. With these symptoms in mind, it's important to understand what causes IBS. What triggers the onset of IBS? A question that has puzzled researchers and doctors alike. There are several potential answers, and today we'll explore 5 of them. First, gut sensitivity. Many IBS sufferers have a more sensitive gut, which means that normal amounts of gas or movement can trigger pain and discomfort. This sensitivity might be due to an imbalance in gut chemicals or a disruption in the communication between the brain and the gut. Second, stress. It's not just an emotional issue, it can physically alter your body. Chronic stress can trigger changes in the gut and exacerbate symptoms of IBS. Third, bacterial overgrowth. A healthy gut has a balance of good and bad bacteria. When bad bacteria overgrow, it can lead to a series of digestive problems, including IBS. Fourth, inflammation. In some people with IBS, the immune system responds to a perceived threat by causing inflammation in the gut. This inflammation can lead to pain, diarrhea, and other IBS symptoms. Lastly, genetics. IBS tends to run in families, suggesting a genetic component. While the specific genes involved aren't yet known, research is ongoing. These causes aren't exhaustive, and often it's a combination of factors that lead to IBS. Every individual's body is unique, and so is their experience with IBS. Understanding these causes, let's now look at the potential complications of IBS. What happens if IBS is left untreated? What are the potential complications? You might be asking yourself these questions, and rightly so. Understanding the potential complications of irritable bowel syndrome, or IBS, can be a significant step towards managing this condition effectively. Firstly, one of the most immediate complications is a decreased quality of life. The unpredictable nature of IBS symptoms can interfere with daily activities, leading to frustration and stress. This can affect your work, social life, and even your sleep, leaving you feeling exhausted and overwhelmed. Secondly, mood disorders are another common complication of IBS. The ongoing physical discomfort of IBS can lead to feelings of anxiety and depression. It's a vicious cycle, as stress and emotional upheaval can, in turn, exacerbate IBS symptoms, creating a continuous loop of discomfort and distress. The third complication we'll discuss is hemorrhoids. Straining during bowel movements, a common symptom of IBS, can lead to hemorrhoids. These swollen blood vessels around the anus can cause additional discomfort and further complicate the management of IBS. Fourthly, malnutrition is a potential yet often overlooked complication of IBS. Chronic diarrhea can lead to nutrient and water loss, while fear of triggering symptoms can result in restrictive eating habits. Both scenarios can contribute to malnutrition, which can have serious impacts on overall health. Finally, it's important to mention social anxiety. The unpredictable nature of IBS symptoms can make sufferers apprehensive about social situations. The fear of an unexpected flare-up can lead to avoidance of social events and public places, contributing to feelings of isolation and loneliness. These complications highlight the importance of prevention and treatment of IBS. The road to managing IBS may not always be smooth, but understanding the potential complications can help pave the way for a more informed and proactive approach to this condition. How can we prevent IBS or manage its symptoms? The first step is adopting a healthy diet. Consuming a balanced mix of fruits, vegetables, lean proteins, and whole grains can help regulate bowel movements. It's advisable to limit the intake of high-gas foods, such as carbonated drinks, certain vegetables, and raw fruits. Next, let's talk about regular exercise. Physical activity helps stimulate normal contractions of your intestines, reducing the discomfort associated with IBS. Whether it's a brisk walk, a swim, or a yoga session, find what works for you and stick with it. Third on our list is stress management. Stress can trigger or exacerbate IBS symptoms. Techniques such as deep breathing, meditation, yoga, or even cognitive behavioral therapy can be beneficial in managing stress levels. Fourthly, getting adequate sleep is crucial. Sleep deprivation can worsen IBS symptoms, so ensure you're getting 7 to 9 hours of quality sleep each night. Last but certainly not least, regular medical checkups are essential. Regular visits to your healthcare provider can help monitor your condition and adjust your treatment plan as necessary. Remember, these preventive measures can help manage IBS symptoms, but they're not a cure-all. Everyone's body reacts differently, and what works for one person might not work for another. However, these measures can certainly improve your overall quality of life. Prevention is key, but in case of an IBS diagnosis, treatment is crucial. How is IBS treated? What are the options? Let's delve into the 5 primary methods of managing irritable bowel syndrome. Firstly, there's medication. Depending on the individual's symptoms, a variety of drugs may be prescribed. These range from antispasmodics to alleviate cramping to laxatives for constipation and antidiarrheals when the pendulum swings the other way. Next, dietary changes often prove beneficial. A doctor may recommend a low FODMAP diet, which means avoiding certain types of carbohydrates that are harder to digest. It's not a one-size-fits-all approach, though. Everyone's gut is unique, so it may take a bit of trial and error to find out what works best for you. Thirdly, lifestyle modifications can make a world of difference. Regular exercise, adequate sleep, and stress management techniques like meditation or yoga can help reduce IBS symptoms. It's all about creating a healthier environment for your gut to thrive in. Psychological therapy is another viable treatment option. Cognitive behavioral therapy, hypnotherapy, and other forms of psychotherapy can help individuals cope with the stress and anxiety that often accompany IBS. Lastly, we have alternative therapies. Some people find relief through acupuncture, probiotics, or herbal remedies. These treatments may not be mainstream, but they can provide additional options when traditional methods aren't enough. While IBS can be challenging to manage, these treatment options can make a significant difference. You're not alone on this journey. With the right strategies, you can navigate your way towards better gut health. To recap, we've explored the world of irritable bowel syndrome. We've delved into its symptoms from abdominal pain to altered bowel habits, identified its causes such as stress and diet, looked at potential complications including mental health issues, and discussed prevention strategies like lifestyle changes. We've also shed light on treatments available, both medical and alternative. Remember, knowledge is power, and understanding IBS is the first step towards managing it effectively.